Hello, everybody, and welcome to episode 2 in this series of podcasts on the AKT. I'm delighted to be joined again by Dr. Chris Else. Chris, thank you for joining us today.
Margaret, and thank you again for inviting me back.
Pleasure. So today we're talking about readiness to sit the AKT. So we encourage all of our registrars to think about when they want to apply for the exam and involve their educational supervisor, their training program director, and even their clinical supervisor in the hospital post. There's so many resources out there. And today our podcast will be how to make the most of that readiness to sit conversation. So Chris, tell me, what are your thoughts on how we can assess if somebody is ready to sit the AKT?
Yeah, no, thank you again, Margaret. I think we referred in our first podcast, didn't we, to sort of stepping back early on and doing a broad sort of scoping exercise, really. So I think this does need to be an early discussion, not a late discussion. We do hear of many stories of educational supervisors finding out their trainees sat the exam after the results come out. And clearly that there's been no readiness to sit type discussion. I would say again, readiness to sit clearly is final decision is for you as an individual trainee. But I think you can get, as you say, really good information by checking and cross-checking with your supervisors. So I think what you're looking for is the early start and an objective self-assessment and the objective views of others. And I think before you can really say you're ready to sit, the first place to start is to look at yourself. How is your health and well-being? How's your motivation and energy? Do you need to address your own emotional well-being? And what life events are happening around you? If I've got a wedding, if I've got some difficult circumstances, if I've got real pressures and travel commitments, and it's all too much for me at the moment, adding a postgraduate medical exam on top of everything you're doing is a really big challenge to yourself, and often very different to how we had to prepare for exams as undergraduates, where we didn't have so many other responsibilities perhaps weighing on us. I think overall, consider this in a sense to a sports analogy. If you're preparing for a big sports event, if you're some capable international athlete, you would look at your health, well-being, what's happening around you, nutrition, sleep, plus your own technique, physical capabilities, etc. And so I'm keen that we look broadly at where we are in our life so that we're in the best place to revise and prepare.
Thank you. And I know in our last podcast we mentioned that even from day one of GP training, there's lots of learning opportunities right at the start in your hospital rotations and in your early GP placement. But when is a good time, if you're in a standard 3-year program working full-time, when is a good time in that program to think about taking the exam?
Again, obviously it will be individual, but I would really encourage people to think, have I had enough general practice primary care UK experience? That will be different for different people on different training trajectories. But within that, I need to be seeing patients. I need to be applying clinical knowledge, whether that's CKS or NICE or SIGN, whatever it is in your formations, applying clinical knowledge in practice. I need to be looking things up. I need to be looking up in the BNF. Every time I see a patient, if I don't know what the common significant side effects are, I should look that up. What are my unmet learning needs as I see patients? I'm really keen that we think about how do we look at blood results? How do we look at prescriptions, both repeat and acute? How do we look at the tasks that come into us as GPs? Because within those, we many aspects that help us think like a GP, which matches to how we might be challenged in the AKT. And something you referred to in the last podcast, Margaret, in terms of dealing with normal results or borderline results. We see those a lot on a day-to-day basis, and they might feature in the exam.
Brilliant. So I think you mentioned a couple of things there, tasks. If somebody is listening to this and they haven't yet done their GP placement, could you tell us a bit about tasks and why that can be a learning opportunity?
Yes, I think part within a busy day we'll have electronic messages, call them emails if you like, within the primary care software that you're using. You'll have messages from your nursing team, from the welfare worker, from another colleague asking you questions. The reception may say, a patient has rung in with this symptom, what do I do? You'll have multiple questions asked of you during the day. So it's another patient contact, if you like, but it might be indirect. And how easily can you manage those? So perhaps you're feeling ready to sit if you can get through the blood results without having to look everyone up and ask somebody. If I can manage most of those tasks, if as I look through my repeat prescriptions, I'm aware of significant interactions and dangerous side effects. So if you can manage those day-to-day requests, that's one of the indicators that you're beginning to be ready.
Thank you. And can you expand a little bit about PASS and DENS for anybody who isn't aware of those abbreviations, and how the trainer sitting with you, how they can help you?
So PUNS, patient unmet needs, and DENS are doctor's educational needs. So in an encounter between a doctor and their patient, there will be things that weren't met for that patient, and there'll be things that the doctor can't answer, and we'll have to look up or find out later or come back to somebody. And so compare those with your trainer's own PUNS and DENS, if you like, as they have to look things up. And how often are you having to look things up? And if that is becoming ever easier, and when you do talk to your trainer, you found you already know the correct answer, so actually did you really need now to talk to your trainer? That's a sign that you're beginning to get much more comfortable with the common things you're seeing every day in general practice.
Thank you. And talking more about time with your trainer, there are many interactions that you will have with your trainer. For example, debriefing after a morning surgery. But how about our workplace-based assessments? Are there any opportunities there to see if the candidate is ready to sit the exam?
Yeah, I think you have several opportunities there, don't you? You've got your random case analysis. How did I manage somebody with abdominal pain, for example? Did I do a pregnancy test in a young woman? Whatever it might be. When you're looking at COTS, when you're looking at the learning logs and how you've reflected on something that you were unaware of. So those workplace-based assessments, if you look at your prescription audit, for example, all of those can feed into how does your educational supervisor, or your clinical supervisor for that matter, Margaret, how do they feel your capabilities are meeting those to which they expect? Because that's another good indicator that you're becoming ready for the exam.
Thank you. And I know it's also really important that we focus on areas that we're less confident in. It's very tempting to read about the subjects we know quite well, but these interactions, as you say, will tease out where we need extra revision. And it's often helpful to make a list of topics that we're finding we need to look at more often.
Yeah, no, I completely echo that. So this then feeds into really being ready to sit. What revision plan do I have? How organised am I about this? You may have a broader revision plan over the 3 months that you're working hard, perhaps, but there'll be a one. What is it for the week? What is it for today? What is it for the hour you're about to do? And it should be based, as you say, on your learning needs. It shouldn't be on your favourite subjects that you're always good at. So where are your clinical and community experience gaps? Where are the gaps for you in the curriculum? And a really good place to look, for example, is the super condensed curriculum guides, within which there's self-assessment, knowledge and skills, short lists. So if I'm not sure about a topic, why not look at a clinical super condensed guide and see how well I could talk through the knowledge that they list. And if I'm comfortable with that, maybe that's an area that I don't need to spend so much time on. These discussions with your ES and your clinical supervisor, it helps to regularly revisit your learning needs. Don't rely on one single learning needs assessment. And of course, you will be doing some question banks as part of your revision, maybe 30-40% of your time. And those question banks help identify and refine your learning needs as you go on. How good are you at explaining things to other people? Can you explain to the medical student, an FY1 colleague, one of the nursing team, your education supervisor? If you can explain something that you felt previously challenging, you've shown that you're ready and understood it.
Thank you. And even if you're in your hospital rotation, there's lots of learning opportunities there. For example, some of the secondary care investigations that a colleague may request. But we've also got to remember that in the AKT, it is primary care that we're testing, but you still need to have an awareness of where secondary care will add value to that patient's journey.
Yes, and thank you for raising that. And of course, we're often part of how we work in primary care is, in a sense, a sales pitch for what might happen if you do accept a referral to hospital. So we need to know some of the basics. If you refer me, it helps if you can tell me roughly what to expect. You're not the specialist with all the details, but if I understand I've got to have an endoscopy, for example, and what that means, that will be helpful to me in accepting the referral. So yes, the AKT can assess what things are likely to happen in secondary care, but not to a very detailed level.
And looking at your own referrals, if you are working in a GP placement, go through your referrals with your trainer and see, were they required, or do we think we could have avoided a referral? And all of that will help assess your readiness to sit the exam.
And that would match looking at your own prescribing again and looking at your own investigations that you request. As the results come back, were they necessary? What did they add? Was I screening for no real reason other than my own self-reassurance, for example? I think another thing, Margaret, about readiness to sit, we've talked a lot about aspects within our workplace, but a big part of this is also thinking about exam technique, for example. And it's not the main part of your revision, but if you're not used to this style of exam, you need to have prepared for it. So when we go back to our question banks that might help identify our learning needs, at some point, a timed practiced exam, or several of those, is a really useful decision, part of your decision for readiness to sit. Can I manage the number of questions in the equivalent time to the exam? How good are you at reviewing questions? So are you a good reviewer of your own questions that you're unsure about, or are you a poor reviewer? By which I mean, if when I look at a question I'm uncertain about and I change the answer and it's always wrong, I'm a poor reviewer of my own questions. And you can objectively find out for yourself in your revision by how good you are at reviewing questions. If overall you find that when you change your answer because you're trying to second guess the examiners, your answers are worse than they first were, then stop yourself doing that. And perhaps then the only time to change your answers is when you go back to a question you've reviewed and slowed yourself down and checked you didn't misread something. A common reason to miss some of the answers is because our brains have read through the computer text very quickly. We've missed a couple of words, for example. We've imposed an interpretation that wasn't there. And when we go back and look at it slowly, the answer is different. Part of exam technique also includes not spending too long on a question you find difficult, guillotine your time, flag it to review it and move on. And the traditional cover test, which came from paper exams in the first place, before you look at the list of answers, think of the scenario just like you would in real life. Here's somebody with these set of symptoms and some results maybe. What do I think the diagnosis is? What do I think the next test is? What do I think the best management is? That's how you approach things in real life. And then look at the answer options. If your preferred option that you've already come up with is on that list of the best of 5, it's highly likely to be correct. And it's a good thing to practice in your self-testing.
Thank you. And the GP self-test on the RCGP website is very, very helpful for doing that. I just wanted to ask, is it worth doing the questions with your GP trainer and actually talking through what your thought process is and comparing that to what your trainer makes of the question?
Yes, and we referred to that in our first podcast, didn't we? And I think that is a really good way of comparing how people are answering questions based on commonality in real life general practice versus the rare things from a medical textbook or the rare things from a tertiary care experience. So yes, I think talking aloud and also some complex questions with your peers. You don't have to do many of these with your trainer, but see how your trainer supervisor answers the same questions as you're looking at and what is their thinking. Why have they gone for an option that's different for you? And trust perhaps their thinking and talk through why they've chosen something differently.
Thank you. And when we think that we're ready to now apply for the exam, can you tell me a bit about sort of deadlines, and if it's right for you, if your style of working and organisation fits that process?
Yes, I think, and this whole aspect of being ready to sit does require us to have our own good or better organizational skills. We need to be good at time management. That's both in the whole process of preparing. So that's why we need to look ahead. We have to look at the exam website for all its resources that we referred to in the first podcast, but the deadlines are there and clearly written. And unfortunately, you might find that the deadline to apply or the deadline to send in the accepted supporting evidence for reasonable adjustments is further in advance of the exam than you assumed. So make sure you've looked at those deadlines, got them in your diary, and are ready to apply in good time. Have a think in your own time management skills. How good at you are you at managing your time, not just in the workplace, but in your revision and your personal life? Are you a procrastinator? Many of us are. And therefore, that can spoil our ability to efficiently get things done, whether that's revision. So if I sit down revision and I'm procrastinating, I've got lots of things disturbing me on my computer screen and I'm reading those instead. I'm avoiding the subject I find boring or difficult. Analyze yourself in this process. I think being ready to sit requires you to have insight about your own drives, your own personality, and your own organizational skills to fit so many things in to be ready and hopefully successful first time. I think there's a good phrase, and again, this comes from sports coaching, the aggregation of marginal gains. So if you said, how do I make myself certain to pass the AKT? I can't answer that. There isn't one thing to do for any of us, but lots of small things over time all add up to a greater outcome when they come together. And that's exactly how a sports coach would look at you and me if we're trying to improve whatever sport we like doing.
Fantastic. Thank you so much, Chris. So do you think you could give us a short take-home summary that we can finish our podcast on?
Yes, thank you. I think don't assume that the exam is easy. So do look early. Don't just rely on question banks. Assess yourself objectively early. Use your own analytical skills as a doctor and use them on yourself. One of our fellows in Wessex, Jazz Candola, he produced the mnemonic that we've got on the national website, PASS AKT. P stands for prepare early. A stands for ask for help. That's your peers, your ES, your TPD, whoever your family. You need help to prepare and have time for yourself to prepare. S, the first S is for study groups or study partners. The second S is sit the exam with GP experience. A is apply your clinical knowledge with the patients that you see. K is know your guidelines. In fact, Jazz, when he wrote this, said know your CKS guidelines. So I guess that has clear reference to most of the exam is about our clinical knowledge. So can we manage? CKS is an excellent resource. Of course, there are many others. And T, take the exam when it's right for you and your circumstances. So I hope that PASS AKT acronym does summarise our discussion, Margaret.
It does. Thank you so much, Chris. And our next episode, we'll be looking at tips on how to approach the exam if you're taking it for the second or third attempt.
Thank you. Yes, and we'll talk about resitting the exam. I look forward to that, Margaret.
Great. Thank you so much, Chris.